Hello everyone, we are from small group discussion B2 are going to present our student project entitled Palliative Care in Dimension of Quality of Life. Here are our group members. This presentation consists of 3 chapters. The first one is introduction, the second one is content, and the last one is conclusion. My name is Putun Indekrisna Dewi Rahadi with the last 3 digits of student identification number is 0 to 8. I would like to explain about the introduction. First, the background. Palliative care is an approach that enhances the quality of life of patients and their families dealing with the issue of life-threatening illness. Each year, an estimated of 56.8 million individuals need palliative care, but only about 14% currently receive it. The incidence, prevalence, and mortality of chronic illnesses are rising globally, including in Indonesia. Meanwhile, quality of life can be defined as a subjective evaluation of life. Individuals with the same disease stage or severity may have vastly different quality of life. Therefore, quality of life is the principal outcome to palliative care interventions. Due to the importance of palliative care and its relation to the patient's quality of life, we are interested in discussing this topic in our student project. That's all from me. Next.
Hello, my name is Justin Ordialin. My student number last 3 digit is 131. I'm going to present you the problem formulation, objective, and benefits of our student project. The problem formulations of our student project is: what is the definition of palliative care? What is the epidemiology of patients suffering of palliative condition? How is the quality of life dimension of palliative care in patients? How is the prognosis of palliative care in patient? How is the clinical trial or the recommendation approach on palliative care? And our objective is to understand the definition of palliative care, to know the epidemiology of patients suffer of palliative condition, to know the quality of life dimension of palliative care in patient, to know the prognosis of palliative care in patient, lastly, to know the clinical trial or the recommendation approach on palliative care. And here are some benefits. The theoretical benefits are to invigorate knowledge and cognition about palliative care in dimension of quality of life. The student project is expected to increase the understanding about palliative care and serve as a literature for further researches and reading references. The practical benefits are expected to increase the knowledge of healthcare professionals about palliative care in dimension of quality of life, so they can apply it in daily life or work decently. That's all from me. Next.
All right, good morning, doctors and friends. Now, first of all, let me introduce myself. My name is Anin Auray Ahmad with the last 3 digits of student ID number 121, and now I will explain about the definition of the palliative care. Palliative care, or PC, is a medical field that focuses on maintaining and also improving the patient's quality of life rather than curing them. In this context, usually it's the patients with chronic or terminal illness. In this definition, PC towards the patient started when the diagnosis of the related illness started. Also, the extended branch of the palliative care is end-of-life care and bereavement care for the loved ones of the patients. Palliative care in its practice keep improving based on the geopolitical, spiritual belief, and socio-economical factors, respectively, in the local healthcare system, in order to improve or maintain an optimal outcome for the patients, sometimes maybe based on the local religion and stuff. So maybe that's it for me. Thank you.
Hello, my name is Putu Syaritaini Pratiwi, student number of 221. Today we'll be talking about the epidemiology of patients suffer of palliative condition. Palliative care is necessary mostly for adults that have a serious, chronic, life-limiting, or life-threatening disease. Heart disease considered the single largest amount of death by 10.7% in 2000 and 2015, followed by strokes 16.2%, cancer 7.6%, and chronic respiratory disease for 27%. A large retrospective study in America demonstrated that most older adults, of which 70% are over 65 years old and 26% are 15 and 59 years old, and 6% of its are children. Equal prevalences of male and female patients in need for palliative care were reported depending on the severity degree of their illnesses. Next.
Hello everyone, my name is Putri Yoga and my student identification number is 2002511084. In this opportunity, I would like to explain about the palliative care of physical well-being. Patients in the palliative stage will usually experience several physical symptoms. These physical symptoms must be managed using palliative care to improve physical well-being, specifically pharmacological and non-pharmacological approach. The most common physical symptoms is pain that can be managed with acetaminophen and NSAID for mild to moderate symptoms and opioid for moderate to severe symptoms. Non-pharmacological approach can also be tried such as massage, acupuncture, and aromatherapy. The second is shortness of breath that can be treated with oxygenation, opioids or benzodiazepines, and non-pharmacological approach including positioning and then breathing techniques and muscle strengthening. The third is nausea and vomiting that can be treated with antiemetic drugs and non-pharmacological approach like good dietary advice, acupuncture, and psychological support. The last is fatigue that can be managed with psychostimulants, methylphenidate, and the non-pharmacological approach like aerobic exercise. Okay, that's all from me. The presentation will be continued by my friends. Thank you. Next.
Hello everyone, I'm Yosefina Graslataji with class 3 student ID number 087, and I will going to continue the explanation about palliative care of material well-being. In Indiana, Midwestern US, the palliative inpatient teams believe that the provision of inpatient palliative care has resulted in reduction in length of stay, rapid hospitalization, and cost effectiveness. They also believe that palliative care makes it easy to identify early about a patient's goal of care and know the best thing for the patient's care. Palliative care, which focuses on coordination and continuity, helps patients to ensure their goals, healthcare settings, and help the patient to prevent unnecessary resource use. Based on few studies, palliative care has already demonstrated high health system cost saving. In patients with cancer, by improving the quality of palliative care we provided in inpatient unit, the admissions were reduced in advance by 48%. Among cancer patients, palliative early outpatient special treatment can reduce emergency department visit by 35% and by 50% on hospital admissions. That's all from me. Thank you.
Thank you. My name is Rati with the student ID number is 20025111177. I will continue the presentations about the palliative care development and activity. One aspect to measure the quality of life of patients with palliative care is to measure or assess how their development and daily activities are. Progress and activity from a quality of life point of view can be assessed by measuring productivity or contribution and how the patient ultimately make his or her choices. Productivity and contribution can be also influenced by several things such as competence, work, homework, hobbies, and education. Competence of patients with palliative care tends to change if it can be compared to when they have not experienced the disease that requires the treatment. This is because there are many activities that should be done independently but cannot be carried out optimally. It also affects work. Many of the patients ultimately have to give up the work they previously did so that it automatically also affects the patient's lack of productivity. Chronic disease patients with terminal condition will also be limited in their activities, including doing homework, hobbies, and activities that support their education. The lack of activities carried out by these patients also greatly affects the productivity and contribution of these patients, which will also affect aspects of development and activity in terms of quality of life. Based on the statement above, it is increasingly clear that in the end, there is need for solution that can be used to help improve the quality of life of patients with chronic disease who are undergoing palliative care with palliative care itself. In the end, palliative care planning is needed that can increase the productivity and contribution of the patients so that they can meet the developmental and activity aspects of these patients. What can be done to design palliative activities such as regular yoga or meditation, activities of aerobics, and so on, that can still meet the goals of palliative care itself? That's all from me. The presentation will be continued by my friend. Thank you.
Hello, my name is Sangaya Putu Damakitala Ferdesuri with last three-digit number is 036. So I would like to explain about palliative care of emotional well-being. So what is emotional well-being? It is a positive state of someone's emotion, life satisfaction, life purpose and meaning, and also self-goal achievement. It is consists of several elements that should be balanced. Those are emotion, social, relationship, pursuits, and also knowledge. In end-stage patient, usually they will show negative emotion. Those are upset, denial, hopeless, loneliness, anger, guilt, fear, and etc. And it can lead to depression and also anxiety disorder, which will impact caregiver emotional distress. That's why we need palliative care for the patient and also caregiver. The goal is to relieve negative emotion or emotional distress and also encourage patient and also caregivers positive emotional well-being. It hopes it can lead to acceptance and also sincerity with positive emotion, like full of hope, full of love, feel secure, feel happy, and also having a meaningful and gratitude life. Thank you.
Hello, my name is Gusti Ayu Ika Prangipani Feranti with the three last digit of my student identification number is 064. Today, I'd like to continue the presentation. Patient and caregiver usually will assess using simple screening tools to detect emotional distress skills. A professional from the palliative team care must, the first one is sit and listen to patient and caregiver, sharing thoughts and empathy, asking if there is any specific desire, recommending enjoyable and memorable activities to do together, and also giving moral support. In some cases of palliative care, there are many interventions or therapies that can be conducted in order to improve patients' and caregivers' emotional well-being, such as cognitive behavior therapy, dignity therapy, meaning-centered therapy, and also specific physical-social intervention. That's all from me. Thank you.
Hello, my name is Anggia Manda Triandevi with last three digit of student ID number R088. I will continue the presentation about the prognosis of palliative care in patient. Prognosis is important not only for the patient but also for the doctor. Prognostication can give patient more time to prepare for approaching death, for example, saying farewell or making financial plans. For doctor, it is crucial for guiding on medical treatment and advanced care planning. Shared decision-making and patient-centered treatment can be facilitated by an open discussion on the prognosis between patient and the doctor. However, these predictions are often inaccurate. Numerous prognostic instruments used in palliative care have received validation either in the hospital, hospice, or even community, such as palliative prognostic score, which combining doctor estimation, clinical features of the patient, and blood tests, the palliative performance scale, which assess patient functional status and ambulation activity. There are also the prognosis in palliative care study or PIPS-A, where the evaluation based on clinical observation, and PIPS-B requires additional blood tests. And the last one is palliative prognostic index, which assess oral intake, the presence or absence of dyspnea, udem, or delirium, and as well as the PPS-based assessment. Next.
Hello, my name is Igor Rahmatawinata with three-digit student education number 061. In this presentation, I will cover about chapter 2.5, clinical care, other recommendation, approach on palliative care. According to World Health Organization, palliative care uses multidisciplinary intervention and management to the patient. There are several management and intervention can be used to the patient, but based on study from Beckham, Mikado et al. 2017, there are several interventions that have been passed clinical trial and are often used. Number one are pharmacological therapy, non-pharmacological therapy, home care-based therapy, communication, and support from family. On non-pharmacological therapy intervention, there are several can be used based on study from Keller et al. 2017. Number one is musical therapy for pain, anxiety, depression, and well-being. Aromatherapy massage for pain, anxiety, and depression, and massage therapy for overcome pain and anxiety.
Hello everyone, my name is Diputulan Siwidantara. With my last three-digit ID number is 173. In this session, I will tell you about the conclusion from our student project. Next. Okay, palliative care or PC is a medical field that focuses on maintaining and improving patients' quality of life and usually related to the patient with a chronic or terminal illness. Patients with a condition requiring palliative care have special attention because will affect their quality of life. Patient quality of life is the most important thing because it will related to their well-being and function in life and includes multidimensional aspects. Palliative care has resulted in reduction in length of stay, repeat hospitalization, cost effectiveness, easy to identify patient's goal of care, and know the best thing for the patient's care. And for several things, our intervention can be provided to patient as an approach in palliative therapy, and the patient's quality of life will be enhanced. Okay, that's all from me. Next. Okay, this is our bibliography for arrange our student project. Next. Okay, next. Okay, that's all from us. We would like to apologize if there is any mistake, and thank you.